this is the real revolutionary thing. I think 7, 8 years ago, we couldn't even think of RSBY because it's totally technology driven. Look at what is happening in Ghana, an outstanding health insurance scheme collapsing. Why is it collapsing? Because they are unable to manage the back-end claims. They don't have the technology, or if they have it, they have not been able to use it. So an excellent scheme, which can actually work excellently, they are unable to do it because they don't have the technology to do it. Now we are in dialogue with them, and we are seeing PhilHealth, another outstanding health insurance scheme. It's collapsing because again the technology that they're using is outdated, and they are now thinking in terms of using technology to manage it. But what I would suggest to those of you sitting here, today technology enables you to manage your claims transparently and quickly, and that's what is the strength of RSBY. Every day the data flows from all these 8,000 hospitals to the respective servers of the insurance company, who on a daily basis analyze this data. And believe me, probably this is the only scheme where we have managed to de-impanel more than 100 hospitals, and all that happened on the next day or within 2 days, because we had the data analyze, visit, and this message has gone around. So hospitals find it very difficult to fraud. How did it happen? Because of technology. And just to digress a bit again, sometimes we don't really understand the utility of technology. I mean, I can barely operate my laptop. I don't know much about technology. But probably I can communicate with people who are IT wizards, and they are helping me in doing it. When we started this smart card, not many people knew the difference between a smart card and an identity card. At that point in time, even I didn't know. I thought that the debit or credit card that I carry in my pocket is a smart card. It isn't. Why it isn't? Because in a normal card or debit credit card, nothing happens to your chip. You shove it in a slot, it accesses the backend data, you punch in some numbers, you access your database, you manipulate the database, you get the money and you're out. Nothing is on the card. So for this sort of a card, you have to have real-time connectivity to the backend system. No? Do we have that online system in India as of now? I mean, I had a long chat with Nandan Nilekani twice, and I told him, for you to actually become operational, you have to have real-time connectivity. So in a country like ours and many other countries all over the world, you have to have an offline system working along with the connectivity part. What does this smart card do? It manipulates the data on the chip regularly as well as the backend. So when you're not connected, irrespective of the connectivity, you know what your status is. The smart card gives you that stated. Whether you use 30,000, 25,000, it's there on the chip. So smart card is data manipulation on the chip as well as the backend. So that if you're not connected, you are able to know the status on the offline system also. And in a country like ours, and in all the South Asian countries, in African countries, even in some of the developed countries, real-time connectivity is indeed a problem. In fact, I was in Germany last month, and the German government was requesting us to help them deliver their social security schemes through the smart card that we're doing here. And I asked them then that since you are real-time connected, you don't really need the smart card. All you need is a connectivity to the central server, and you can manipulate data on the central server. And I was quite surprised to learn that there are pockets in Germany which are not real-time connected. And if you're not real-time connected, you are in trouble. It's not like ATM, ATM, there's only some data being transferred and you are connected there. But in a number of places you aren't. If you aren't connected, then you have to have an offline system. But now you have technology, smart card technology. You have UID coming in, which will be a phenomenal thing if and when it happens. We have a problem of identification. UID would do it. Then medical technology. Again, you have a session on how technology can be used. But the problem, I don't think, is technology per se in India. The problem is adaptation and adoption of this technology. Now, doctors are not attitudinally equipped to use these tools. They still prefer writing. Or they have somebody sitting there to type it out for them. So when you want to digitize all the data, you have to have somebody to do it, because doctors, most of them, in the best of hospitals, there's a doctor sitting here, he'll bear me out. Whether the doctors are very comfortable with entering the data, no, that's the problem. So the bottom line everywhere in India, I don't know elsewhere, is attitude, whether it's bureaucrats, whether the private sector, whoever.
What is UID?
Unique identification number. This is Mr. Nandan Nilekani's baby. I'm surprised. I thought the world knew about UID. Okay. So we'll get to know more about it subsequently.
Unlike Pakistan,
We don't have, each one of us don't have a social security number. So we don't really, if they ask me to introduce me, if I had a UID, I would have first displayed my UID here. That's my number. In India, anyone could be, so to say, in India without knowing the number, because we don't have a unique number. Now probably we'll have it. Next one. Now this is the changing here. Increased realization for social security, I mentioned that in general, and health insurance particular. Political acceptability. Now this was very, very important. You know, I have always believed that any scheme is worth its salt if it is politically acceptable, socially desirable, and financially sustainable. If you don't have these three things going, you'll have pilots, pilots, and pilots, and it won't scale. You have to have these three things going. And it's an art to convince the politician. To begin with, it was difficult, but later on, politicians were running after me. I remember Chief Minister of Punjab coming all the way to Delhi to have a discussion with me on this scheme, because he found value. There again, it's an art. We have to innovate and package a service or a product in a manner so that decision maker buys it. Normally, when I was in industry, I used to tell all these industrial houses that when you come to meet a minister, you give him a document. When you meet the secretary, you give the same document to the secretary. When you meet the joint secretary, you give the same document to the joint secretary. And I used to tell them, you are good at marketing, but you are very poor at packaging your ideas. You have not even understood what that guy wants and you're giving him. You have to prepare separate documents for them. You have to understand who he is. And I have a slide when we did this scheme, how we did it. Now, bureaucratic. There again, there is a huge change that has come about in the bureaucracy. The acceptance of the fact of public-private partnership, the acceptance of innovative thinking, it's happening. I visit the academy which trains the IS officers almost every month or once in 2 months, talking to the budding bureaucrats who put in 15, 20 years, 20, 25 years, and I can see the change. So it's there. It's for you to perceive it. It's for you to leverage it. You can always paint the entire bureaucracy in a particular color, but it's not so. Like in the private sector, within the bureaucracy, there are good, bad, and ugly people. You have to find your own people. You have to find out who you can associate yourself with. So there is a change. There is the acceptance. And there is an increase. There is a huge market. There is increased interest among hospitals, TPAs, and insurance on the micro business. I remember very clearly when we were when I had the first session with the insurance companies, half of them didn't believe what I was talking. They said, another nonsense coming from the government. Realistically, at least 3, 4 of them were yawning quite openly just to convey to me what nonsense you're talking. It won't work. And I don't blame them, because we've come up with schemes after schemes after schemes. They thought this is another announcement. But things have changed. They have changed. They are ready for it. So that's the changing environment. How to innovate. This is important. And this is my limited experience. I think you are greater innovators are sitting here, but I'll share with you what we have attempted to do. First and foremost is understanding the characteristics of the target group. I shouldn't be talking this to you. This is basically the businesses who talk about it, a bureaucrat talking about understanding the audience. We don't believe in that. We only believe what we believe in, and we say, this is it, period. But we started thinking innovatively here. Then fathom the limitations. This is very, very important, and I think I have a slide. Spend time on product designing. Again, these terms, within the bureaucracy, I found it very difficult to sell all this. What do you mean by product designing? What do you mean by product? You have scheme designing, you design a scheme. What is product designing? Next one. Okay. I'm taking this as an example, and this would apply to any scheme that you evolve. When we were evolving RSBY, one of the reasons why RSBY happened was that we looked very closely at the consumer. And let me explain this to you. For us, this consumer to begin was poor, and hence we had to evolve a cashless health insurance scheme. Because he couldn't pay upfront and then claim it from the hospital. No way. In any case, if he had money, he wouldn't need me. He doesn't have money, and that's why I have to have a cashless scheme. Hence, the bottom line was that if we were to have a health insurance scheme, it had to be cashless. So this was not a big deal, because there were indeed a few cashless health insurance schemes going around. So we didn't have much of a problem doing this. But the second one was very difficult. Most of these guys were illiterate. So we wanted the scheme to be paperless. There's no health insurance scheme anywhere in the world which is paperless. And we didn't want this guy to sign anywhere, because he's petrified of signing. I don't know how many of you know the village as well. Those guys are petrified of putting their signatures on any paper, because they know they would think that the land will be taken away, someone will defraud them something. We didn't want them to sign any paper. We didn't want any paper in the scheme. This was the biggest challenge that the scheme faced. So we evolved, which has now come to be known as by and large a paperless scheme, where everything happens electronically. Everything, procedures at the documentation at the hospital when the patient visits, the transmission of data, it is digitized, it goes to the insurance company, payment electronically to the hospital. That's how the scheme is designed. Almost 70 to 80% it's happening, rest of it will happen over a period of time. But this was very difficult. And finally, we also looked at the target population. A lot of them migrate from Bihar to Punjab, from UP to Punjab, from Odisha to Andhra Pradesh. And there is no scheme in the country, no scheme, where benefits that accrue to him in a particular state can be available to him outside the state. No scheme. Now, I can't ask him not to fall ill when he, in fact, travels to another state. The chances are that he's likely to fall ill when he travels rather than when he is where he is, because he's got used to that environment, and when he goes to another environment, the chances are that he will fall ill. So we had to evolve a scheme where benefits were portable. He could use these benefits anywhere in the country. This was a huge challenge, and that's where the smart card came handy. And that is when we evolved this scheme, this smart card, because we have a platform, the same platform throughout the country, a smart card issued, any part of the country is valid in any other part of the country, in any of the empaneled hospitals. So when you evolve a package, these may not be the characteristics of your target group, but I think this is a very, very important aspect that we have to look into. In government, we never looked into the consumer. We looked into ourselves and said, this is what is required to be done, and jolly well be done.